So let us start another beta-lactams cephalosporins. So before going to start this one, first we have to go through the silent features. Regarding silent features is concerned, because this drug belongs to beta-lactams, that means कि this cephalosporins also have beta-lactam rings like the penicillins, and cephalosporin is both structurally as well as functionally related to the penicillins. Most of the antibiotics that belongs to these cephalosporins are semi-synthetic in nature, and they usually, primarily, or almost all the cephalosporin possessing a functional group, we are calling it the 7 cephalosporinic acid. However, in case of penicillin, it was 6 amino penicillinic acid, and in case of cephalosporins, this is 7 aminocephalosporinic acid. This is 7 aminocephalosporinic acid. This is you have to make it correct. This is 7 aminocephalosporinic acid. This is the, and this 7 aminocephalosporinic is also known as Cepham nucleus. So what is the meaning of Cepham nucleus? Cepham nucleus means that this nucleus is not only possessing by the cephalosporins but penicillins, both are possessing the possessing the Cepham nucleus. In case of cephalosporin, the drug that belongs to this group, they all possess the prefix Ceph, C-E-F, or C-E-P-H. So, majority of drug that belongs to cephalosporin group are possessing prefix Ceph. So this is about the silent feature. Another silent feature is that, as I earlier mentioned, that beta-lactams are bactericidal, so cephalosporins are also bactericidal, and this drug is also if ineffective against some of the bacteria, and that bacteria are Listeria monocytogenes, Clostridia difficile, and Enterococci. And also a new entrant in this cephalosporin group was the fifth generation cephalosporins. The fifth generation cephalosporin is a new entry, and that fifth generation cephalosporin is acting against the methicillin resistant staph aureus. However, the generation 1, 2, 3, and 4, these all the four generation are ineffective against the bacteria like methicillin resistance staph aureus, Listeria monocytogenes, Clostridial difficile, and Enterococci. So, cephalosporin are not going to kill these bacteria. In a new entry, that belongs to the fifth generation cephalosporin, that is going to kill this one, methicillin resistance staph aureus. So you may or may not delete this also, this one. Now we have to go through the history, chemistry, and source of the cephalosporin. So this is very interesting, that I earlier mentioned that this cephalosporin belongs to beta lactams. That means that this cephalosporin also possessing beta lactam ring. So this is the beta lactam ring of the cephalosporins. So this cephalosporin not only possessing this beta lactam ring, also possessing side chain. This is the R1 is the side chain, then beta lactam, and then also possessing a ring. We are calling it dihydrothiazine ring. In case of penicillin, there the ring was thiazolene ring. In case of penicillin, here this ring was called thiazolene ring. However, in case of cephalosporin, the ring is dihydrothiazine ring. And of course, the beta lactam should be there because the antibiotic is beta lactam and the side chain is there. So this from here to here, this is called from here, I mean without side chain, this is called cepham nucleus or called 7-aminocephalosporinic acid. 7-aminocephalosporinic acid or cepham nucleus, that is without the side chain. So 7-aminocephalosporinic acid possessing beta lactam ring plus dihydrothiazine ring. The from this one, Cephalosporium acromonium, from this Cephalosporium acromonium, the cephalosporin was isolated in the year 1948 by the scientist Broju. So Broju has isolated the cephalosporin from Cephalosporium acromonium, and the name of this microorganism is easy to recall because the name of the antibiotic group is cephalosporins and the name of the microorganism is Cephalosporium. So Cephalosporium acremonium, from which that has been isolated the antibiotic, and that antibiotic is called cephalosporins, and that are usually three types: cephalosporin P, cephalosporin N, and cephalosporin C. So C capital and a small p stand for cephalosporin. So there are three antibiotic has been isolated from this microorganism, and the cephalosporin was P, N, and C. And from this cephalosporin C, the scientist was isolated the cepham nucleus, or you can say 7-aminocephalosporinic acid, or active nucleus of the cephalosporin has been isolated from cephalosporin C. So from this cephalosporin C, the active moiety of the cephalosporin has been isolated, that is called cepham nucleus, and that is 7-aminocephalosporinic acid, and this is without the side chain. So when you are putting side chain with this cepham nucleus or 7-aminocephalosporinic acid, as a resultant you will get the semi-synthetic cephalosporin. So addition of side chain with the 7-aminocephalosporinic acid is the formation of semi-synthetic cephalosporin. So when you are putting this side chain with the 7-aminocephalosporinic acid, there is increase in antibacterial activity. So this is the positive point. So cepham nucleus means, or cepham means, this include cephalosporin as well as the cephamycin. So cepham nucleus is equal to cephalosporin and cephamycin. So now we have to go through the and from where this cepham nucleus has been isolated. Cepham nucleus has been isolated from the cephalosporin C. Now we have to go through the chemistry, or you can say a structure activity relationship of this one. So usually you are going to change here also you are going to change the at here, this is the seventh position, so there is change at position 3. So this is where the R2 is there, this is called position 3. This is present in the dihydrothiazine ring. So number 3 is present in the dihydrothiazine ring. Whereas number 7 here, this number 7 is present in the beta lactam ring. So beta lactam ring is usually responsible for antibacterial property. So when there is substitution or change in the structure at position 7 you are going to do, then as a resultant you will get the antibiotic that is change in antibacterial activity. So substitution at position 7 of the beta lactam ring giving the semi-synthetic cephalosporin with increased antibacterial activity. However, when you are going to change the structure at position number 3 of this dihydrothiazine ring, that is change in pharmacokinetic property of the cephalosporin as well as the metabolism of the cephalosporin, and change at position R1 that is called side chain, as a resultant we have to receive the semi-synthetic cephalosporin. And when you are going to change the number 1 position, at number 1 position there is presence of sulfur group. When you are going to change this sulfur group with the carbon, removing of sulfur and addition of the carbon, we are going to call carbazepam. So carbazepam is the cepham nucleus in which we remove the sulfur element from the dihydrothiazine ring with the carbon. As a resultant, we get the group, we are going to call it the carbazepam, and carbazepam has one antimicrobial agent, we are calling it carba we have discussed this later on. Now we have to go through the this one. So this we already discussed this. So from the cephalosporin C on acid hydrolysis we receive the 7-amino cephalosporinic acid, and addition of side chain we have received the semi-synthetic cephalosporin. So this is about the cephalosporin C, side chain, dihydrothiazine ring and beta lactam ring. And the structure activity relationship, SAR, stand for structure activity relationship, that we earlier mentioned. Change at position 7 of the beta lactam ring, increase in antibacterial activity, change in and again here is very interesting point is that I already left there, that when you are going to add methoxy group at position 7, when you are going to change this 7 position with methoxy group, that is OCH3, then as a resultant you will get the antibiotic group that we are calling it cefamycin. So what is cefamycin? Cefamycin is the antimicrobial agent that in cepham nucleus we are going to put the methoxy group OCH3 at position 7, and as a resultant we get the antibiotic, we are calling it the cefamycin. And in this cefamycin there are two important antimicrobial group that are cefoxitin and cefotatin. What is interesting with these two are that these two are having some more better antibacterial activity that we are going to discuss here also. What they have, the additional property, they are going to act on the B fragilis, that is the anaerobe that is the Bacteroides fragilis. So cephomycin is also acting against the anaerobe Bacteroides fragilis, and this cefoxitin is a cephomycin has been isolated from Streptomyces lactam durans. So actinomyces Streptomyces lactam durans, the antimicrobial agent that isolated is called cefoxitin, and cefoxitin is called cefamycin because this is possessing the methoxy group as 7 position of the beta lactam ring of the 7 amino cephalosporinic acid. So beta fragilis is an anaerobe. So this both cefoxitin as well as the cefotitan is acting against the anaerobes like Bacteroid fragilis or B fragilis. So this is very important antibacterial activity that cefamycin possessing. As I earlier mentioned, then you are going to substitute at position 3 of the dihydrothiazine ring that I already mentioned. This is the at 3 position. So this is the 3 position. So this is the 3 position. This is the 3 position. So at R2, when you are going to substituted with the substituted there, then as a resultant, the compound are possessing different property. What the different, that is change in metabolism as well as the change in pharmacokinetic property of the cephalosporin. As I also earlier mentioned, when you are going to remove the sulfur atom from the dihydrothiazine ring of the 7 amino cephalosporinic acid, that is resultant we obtained the compound, we are calling it the carbacefam. Carba means carbon. Addition of carbon at cepham position, at cepham nucleus is called carbacefam. So where this addition occur? At the sulfur, removing of the sulfur with the carbon, and as a resultant we receive the group we are calling it the carbacefam. And in this carbacefam the antibiotic was only one, that is called loracarabef. So loracarabef is a carbacefam. However, cefamycins are cefoxitin and cefotitan, and these two are also placed in the cephalosporins group. This is also going to kept in the cephalosporin group. Which one? Cefamycin. Now we have to go through the. So what is the interesting point with the carbacefam? That is the laracarabef, that is very much stable against the beta lactamases, that the enzyme that produced by the resistant bacteria, and beta lactamase enzymes are for penicillin penicillinase, for cephalosporin cephalosporinase. And now we have to go through the classification of the cephalosporin. So cephalosporin has been classified on generation basis, and this is the most accepted classification of cephalosporin. So there are 5 type of cephalosporin. The fifth one is the newly introduced, and you will found in the new edition of the book. And the fifth edition of the fifth generation cephalosporin, what is the interesting property that the fifth generation cephalosporin have? That drug is possessing the anti-bacterial activity that all the four generation do not possess, and that is activity against MRSA. M for methicillin, R for resistant, S for staph, A for aureus. So this fifth generation cephalosporin is only one drug that is active against the methicillin resistant Staph aureus. So we have to go through one by one. So we have to go through the one by one. That is, the first one is the first generation. So first generation we are calling it, this is the penicillin G substitutes drug, substitutes antibiotic. So first generation cephalosporins are penicillin G substitute. So whenever you are not able to put the penicillin G because of the problem of the sensitivity, hypersensitivity reaction by the patient, in that place you have to use the cephalosporin first generation. So which one the drug that are very much usable in this, that the drugs are cefazolin, cephalexin. These two drugs are too much used in this first generation cephalosporin. And other than that, cephalothin is also used in the first generation. So there are three main drugs that are to be used for the therapy, that are to be used in first generation, and that are cephalexin, cefazolin, and cephalothin. The cefazolin and cephalothin are the used for only parenteral administration for both intramuscular as well as the intravenous use. However, the cephalexin is for the oral administration, and the cephadroxil is also to be used. What is the important point with the cephalexin with the veterinary? Because this powder is also coming for veterinary purposes, for the therapy for the poultry, as well as that is also going to go use as a intrauterine antibacterial agent. So cephalexin is the very important. So what is the more important point against the antibacterial activity is that the drug is showing antibacterial against both gram positive and the modest activity against the gram negative bacteria. And what is the important regarding the gram negative bacteria is important. So against the good activity against the gram negative bacteria, the first generation drug also possessing very good activity against the gram negative bacteria, not against the pseudomonas. And you have to recall this by PEC. P for Proteus mirabilis, E for Serratia coli, EC for Serratia coli, and K for Klebsiella pneumonia. So this drug, first generation, is active against the PEC and also against this also. So this is very important, and this drug is not acting against the first generation cephalosporin, are not acting against the enterococci, methicillin resistant Staph aureus, and Staph epidermidis. So this is very important. So cefazolin, or you can say all the first generation cephalosporin like cefazolin, cephalexin, are to be used. Why here we wrote about the cefazolin? Because this is the parenteral administration is coming. So this we are using as a prophylactic measure for the before using surgery, as a prophylaxis as a prophylaxis measure. And this drug is also important because those bacteria that are resistant to the penicillin, that may become susceptible to the first generation cephalosporin. So cefazolin, beta lactam ring of the cefazolin is not going to be destroyed by penicillinase. This is producing particularly penicillinase produced by the Staph aureus. This is used as a prophylaxis measure before surgery and also for the orthopedic surgery. So this is about the first generation. Among the first generation, the drug important are cefazolin, cefuroxime, and cephalothin. Now we have to go through the second generation cephalosporin. Among the second generation cephalosporin, what is interesting and differ from the first generation is that the second generation gram negative antibacterial activity is more than the first generation. So this is important for gram negative. So, but less than the third generation. So don't recall much, but you have to recall only that the second generation cephalosporin have increased antibacterial activity against the gram-negative bacteria like PEC. In addition to PEC, they are also acting against others gram-negative bacteria like Haemophilus influenzae, Enterobacter aerogenes, and Neisseria species. And this H. influenzae is going to responsible for meningitis, and particularly the therapy of this we are using the drug cefuroxime, that is a second generation cephalosporin. So second generation cephalosporin antibiotics are, and that are also too much are used to, that are cefuroxime and cefamendol. But cefuroxime is important because this is also used for the therapy of meningitis, and this is coming in the parenteral administration. But when you are going to put here the exitil, then this become oral preparation. So cefuroxime is a parenteral preparation. However, cefuroxime exitil is a oral preparation. In this oral preparation, generally carbazepam and cefamycin, is usually kept in second generation cephalosporin. So carbazepam and cefamycin are kept in the second generation cephalosporin. Cefuroxime, cefamendol are second generation cephalosporin. However, loracarabep is a carbazepam, and cefoxitin and cefotitan are cefamycin. Cefoxitin and cefotitan are cefamycin, and I earlier mentioned that this cefamycin is acting against the Bacteroides fragilis, B fragilis, that are anaerobes. So this is the very very important property of this drug. And that is also very important with the cefamycin is that they are also stable against the beta lactamase produced by the gram negative bacteria of Bacteroides fragilis and Pseudomonas aeruginosa. So this drug that belongs to second generation cephalosporin have increased gram negative activity not only against the ceph gram negative but also against H. influenzae, Neisseria, Enterobacter aeruginans, as well as acting against Pseudomonas aeruginosa and Bacteroides fragilis. And for this particular Bacteroides fragilis and Pseudomonas aeruginosa, the drug that belongs to second generation are cefamycin. That the drug are only two, that is cefoxitin and ceftriaxone, that we earlier discussed. The cefoxitin and cefotitan. So cefoxitin and cefotitan is used for the therapy of Bacteroides fragilis and Pseudomonas aeruginosa treatment. Now we have to go through the third generation cephalosporin. So regarding third generation cephalosporin is concerned, there are the drugs that are to be used under the third generation. Before going to go through the third generation, here I am going to mention that again their antibacterial against the gram negative bacteria is increasing than the first and second generation. However, the gram positive activity of the third generation cephalosporin get reduced compared to first generation. So this is very very important one. Another important one is that this group is also possessing the activity against the Pseudomonas aeruginosa, like the cefomycin that possess in case of second generation. So third generation drug like ceftizidime, they not only acting against the PEC for Proteus, E for Escherichia coli, and K for Klebsiella, and not only against the H. influenzae Neisseria species, but in addition to that, they are also acting against the Pseudomonas aeruginosa, and as well as acting against the meningitis, particularly the drug like cephalosporin and ceftriaxone, that are the third generation. So first we have to discuss what are the drugs that are coming under the third generation. Third generation cephalosporin are cefotaxime, ceftriaxone, cefdinir, then ceftizoxime, then cefaxime. So this cefaxime, cefotaxime, and ceftriaxone and cefdinir, these 4 5 drugs are too much are usable for not only veterinary purpose but also for the human purpose. This ceftriaxone is the drug is very much usable for the veterinary purpose. And what are the other point that cefdinir is the beneficial point is that ceftriaxone is excreted mainly through the bile. So we have to discuss in the pharmacokinetic property later on. So cefotaxime and ceftriaxone, these two are also possessing very important properties that they crosses the blood-brain barrier. So when the drug is going to crosses the blood-brain barrier, it will reach sufficient concentration in the cerebrospinal fluid. So if the sufficient concentration in the cerebrospinal fluid, then drug should be used for the therapy of meningitis. So therefore, the third generation cephalosporin, cefotaxime, and ceftriaxone is used for the therapy of meningitis, and cefotaxime have the very important properties that are also also showing efficacy against the Staph aureus and Staph pyogen. And here we are going to mention very important point is that the second and third generation cephalosporin possessing very good efficacy against the Pseudomonas aeruginosa, that is the gram-negative bacteria, and as also Escherichia coli, that is also the gram-negative bacteria. Now we have to go through the fourth and the fifth generation. So under the fourth generation is that what is interesting point with the fourth generation is that when you have to move from first generation to third generation, usually gram positive activity is decreasing. However, gram negative activity is increasing. Means when you are moving from first generation to third generation, gram positive activity is decreasing. However, gram negative activity is increasing. But when you move in the fourth generation cephalosporin, you will find the interesting property is that the fourth generation is not only possessing the better quality and possessing the antibacterial against the gram negative bacteria, but as well as the having the better property against the gram positive bacteria than the first, second, and third generation cephalosporin. So this is very important. Under this, the most usable drug is cefepime. So cefepime is the most usable cephalosporin in a human being, and also cefpirom is also the new entry. So cefpirom, and the next is the cefquinone. So these three are the fourth generation cephalosporin, and the fifth and the last. So when you have to move from first to fourth generation cephalosporin, all the generation from 1 to fourth are usually not showing activity against the methicillin resistant staph aureus. However, the fifth generation cephalosporin, and in this only one drug is isolated, not isolated, has been reported, and that the drug was ceftaroline. Ceftaroline is a fifth generation cephalosporin possessing antibacterial activity against the methicillin resistance staph aureus. What is the other interesting point with this is all about the classification of cephalosporin based upon the generation basis, and which one is most acceptable classification of cephalosporin. Now we have to go through the mechanism of action. Again, mechanism of action of this cephalosporin, like the penicillin, is the same. So we are not going to move in elaborative way of the mechanism of action or pharmacodynamic of cephalosporin or cefamycin or carabep. We are only going to finish in one line that likewise the penicillin, cephalosporin is going to inhibit the cell wall synthesis by inhibiting the group of enzyme that we are calling it PBPS. P for penicillin, B for binding, and P for penicillins. So penicillin binding proteins are enzyme on which the beta lactams antibiotic are acting, and therefore it inhibits the synthesis of cell wall, and therefore it inhibits the bacterial cell wall lysis occur. So we are not going to discuss this in broadly, because this was already discussed in the previous class. Now we have to discuss about the resistant bacterial resistance. The bacteria develop a resistance against the cephalosporin. So likewise, the mechanism of action of the cephalosporin, the resistant property is also same for cephalosporin, likewise the penicillin. So what was that? First, they are going to inhibit the entry of the drug. So once the drug should not reach at the target site at sufficient concentration, how the drug should act? So there is alteration in permeability or inability to reach the drug at site, that is by efflux mechanism or influx mechanism. So when there is invasion of influx, the not drug is reaching sufficient concentration, and when the efflux is activated, drug is throwing out from the target site. So in both the cases, they are going to change the permeability. Next is the alteration of the enzyme. So as a summation, the enzyme we are calling it the binding penicillin binding protein. So penicillin binding proteins are the enzyme on which beta lactam antibiotics are acting. So these enzyme, when get the change by the resistant bacteria, how the drug is going to get the susceptible bacteria, that is the structure change is there. So the drug is not going to identify the target, so therefore they are going to produce the resistance. Next is the change. This is about the resistance property. Now we have to go through the pharmacokinetic property of the drug. So pharmacokinetic property of cephalosporin means absorption, distribution, metabolism and excretion of the cephalosporin. Here we are not going to discuss this in broad way. Here we are going to discuss few points, silent feature of the pharmacokinetic. So first we have to go through the absorption. If the absorption of the drug is concerned, drug is possessing because of the poor oral bioavailability. So when the drug is possessing the poor oral bioavailability or absorption, then why we should administer it through the oral route. So the drug belongs to cephalosporin are in majority of case administered parenterally because upon oral administration their ability are poor. So this is very important point. Another important point regarding distribution of the cephalosporin is concerned, the drug is distribute or cover throughout the body like body fluid, and this is the example as I earlier mentioned, the drug like cefotoxim produce the cefotoxim and ceftriaxone is going to reach in the cerebrospinal fluid and therefore used for the therapy of meningitis caused by particularly H influenza. So this is important. Regarding the cefazolin is concerned, as I earlier mentioned, we are using cefazolin. This is first generation cephalosporin and used for prophylactic measure before the surgery. And this is drug cefazolin is also possessing penicillinase producing a step aureus resistant property. What it means, if any bacteria is producing penicillinase by the step aureus, this penicillinase is not going to destroy the beta lactam ring of the cefazolin. So that is why this is the important. Now we have to go through the other pharmacokinetic property. Their protein binding are low, means cephalosporin usually possess the low protein binding. However, in the same, the ceftriaxone protein binding is high. Now we have to go through the metabolism. As we have to know here, the majority of the drug that we are going through that are metabolized by the liver. So metabolism of the drug or the cephalosporin group occur in the liver. Regarding excretion of the drug is concerned, drug similar to penicillin as is excreted by the tubular secretion and glomerular filtration. However, the tubular secretion of the drug is the primary route of concern through the kidney. Glomerular is also there, but less is there, and that is the reason the one drug probenecid, as you know, that probenecid is or R is going to decrease the tubular secretion. So when there is decrease in tubular secretion occur, the cephalosporin group of drug will persist within the body of patient for longer time interval. Therefore, we are going to increase the half-life of the drug. So that is why the excretion is the important. So that these drugs are possessing low uh, tubular secretion, therefore low tubular secretion, and therefore drug has to maintain higher half-life when we are going to use these drug along with the probenecid, because the probenecid going to reduce the tubular secretion of the drug, and therefore the drug is not going to secreted or excreted out through the urine. It will remain in the plasma or serum and persist for the longer shorter time interval, increase in half-life, and that it will act for longer time interval. That I earlier also mentioned, the drug that belongs to third generation, like ceftriaxone, cefotaxime, and in fourth generation cefepime, they are, and also the second generation one cefuroxime, they all are to be used for the therapy of meningitis. So from the second generation cefuroxime is there for the meningitis treatment. For the third generation, the drug like cefotaxime and ceftriaxone, and from the first generation, this is the cefepime, that are to be used for the therapy of meningitis in case of, particularly in case of human being. So this is very, very important. There are drug cephalosporin also crosses the placenta, and that will reach in the higher concentration in the synovial as well as the pericardial fluid. Now we have to go through the untoward effect. So untoward effect of the cephalosporin is very, very important. Why this is important? Because similar to penicillins, the cephalosporins also possessing the hypersensitive reaction. So this is the hypersensitive reaction like anaphylaxis, bronchospasm, urticaria are there. Other than the drug like cefamendol, cefotitan, cefoperazone, and also other drug that belongs to cephalosporin, when they are going to take along with the alcohol, so this is going to produce the toxicity. How this is going to produce the toxicity? Sulfur alcohol, when we are going to take with the cephalosporin drug, they are going to go through the they are going to go through the acetaldehyde accumulation. And when there is acetaldehyde accumulation occur, this condition is we are going to call disulfiram like effect, and going to produce the effect we are going to call it the disulfiram like effect. So cephalosporin, if we are going to administer simultaneously along with the alcohol, try to increase the drug, keep the drug, try to increase the number of equipment. So this disulfiram like effect is that these are going to produce the disulfiram like effect when you are going to take with the alcohol. So therefore they are going to produce the acetaldehyde accumulation. So when there is acetaldehyde accumulation occur, this is going to produce the toxicity group. We are going to call it the MTT. So what is this MTT? MTT, this is the methyl thiotetrazole. So this is toxic in nature. So next is the bleeding. This MTT group that was formed when we are taking cephalosporin along with the alcohol, they are going to form the MTT group, and this MTT group is a anti-vitamin K effect. So there is deficiency of the vitamin K. And the last one is the cefepime. Cefepime is possessing the side effect seizures. Now we have to go through the therapeutic use of the drug. Regarding therapeutic use of the drug is concerned, first generation up to fourth generation, we are going to use this drug as a prophylaxis measure before surgery of the skin and soft tissue infection of Staph aureus and Staph pyogenes. So the first to fourth generation, that is the first generation, second generation, third generation, and fourth generation are to be used for the infection of skin and soft tissue infection. Other than that, the second generation cephalosporin that are also to be used for the treatment of urinary tract infection and respiratory tract infection and mixed aerobic and anaerobic infection. So this is very very important. Regarding third generation is concerned, this third generation cephalosporin is a drug of choice for serious infection. So third generation is the very very important because the drug like ceftriaxone and cefotoxim that are going to be passed out through the blood-brain barrier and coming in CSF and used for the meningitis. So this serious infection is to be used to cure with the cephalosporin. Other than that, the drug is also active against the pneumococcal infection, RTI infection, and blood infection. Regarding fourth generation is concerned, fourth generation is a broad spectrum drug or broad spectrum antibiotic, and that are going to possess the very good gram negative activity or gram negative antibacterial property, along with that is going to kill the bacteria that we are going to recall by space. S for Serratia, P for Proteus, F for Actinobacter, C for Colibacter, and E for Enterobacter. And the fifth generation cephalosporin that we are going to call it, that I earlier mentioned, there are only one drug that belongs to fifth generation is ceftazoline. And in earlier we already mentioned the Ceftaroline is possessing antibacterial activity against the methicillin resistant staph aureus. So this is all about today class.